Hello, and welcome again to the second video of the series of study skills and learning skills for undergraduate medical education. My name is Mohamed Hassan Taha. I'm the director of the Medical Education Center at the University of Sharjah, and I will be presenting to you this series of videos related to study skills and learning skills for undergraduate medical education. Today's video will be about learning principles for medical and dental students, how to learn effectively in medical school. So why this topic is important? Many high achieving students struggling in medical school, not because they are less capable, because they use the wrong learning strategies. Moreover, medical schools demand huge amount of information which need long-term retentions, need clinical reasonings in which we need to integrate basic science with the clinical science, and there is a need for application of knowledge. This depends on how you learn matter more than how long you study. Many students often report studying with long hours with little retention, forgetting during exams, feeling overwhelmed despite of effort. And this is a very important question for you. What worked in school, secondary school, that no longer work now? We need to learn the study skills and learning skills that will help us to be study smart rather than working hard. It's very important. It's not about working hard. It's about studying smart. Let us see the outcome of this session. I'd like to explain the learning and its component, describe the key principles that enforce learning, discuss the major learning theories relevant to medical education, and differentiate between important concepts. It's very important for us as learners to know them. So the importance of study skills for us as a student, because studying in medical and dental school is not about only passing the exam. It's about to be prepared for what? For safe patient care, accurate clinical decisions, and lifelong clinical practice. On the other hand, poor study strategies lead to superficial understanding, which is not acceptable in medical and dental practice and other health science practice, rapid forgetting of the information, which is very serious, and unfortunately it may lead to unsafe future practice. Let us start with defining the learning. What do we mean by learning? So there are many definitions in the literature about learning. Learning is the complex, and these definitions based on scholar understanding of the learning theories. So it is a complex and dynamic process that involves the acquisition, retention, and application of knowledge, skills, behavior, and attitude. So it is a process resulting in some modification relatively permanent in behavior of the learners. And in order to prove that learning has taken place, there should be observable change in behaviors. And this change will be observable in knowledge, skills, and attitude. And we should distinguish between the learning and studying. Let us define what do we mean by study. Study is devoting time and attention to gain knowledge and skills for an academic subject. So there is a difference between studying and learning. Learning is the process itself, and studying is the intention to gain the knowledge and skills. So what is the medical education? Medical education is the systemic preparation of future doctors and dentists or healthcare professionals. Why? To practice safely, ethically, competently, and most important, to be socially accountable, responsively to the societal needs, not only responsively actually responsively, proactively, and healthcare system change agent. This is very important. It integrates scientific knowledge with the clinical behavior, clinical and technical skills, clinical reasonings, and most importantly, as we discussed in the previous video, professionalism and communication. So the goal here is to have to be a competent in real practice, not only exam success alone. So it is art and science of educating future doctors to practice safely in the society. Why art and science? It is a science because it is grounded in evidence, theory, and systemic methods. And it is the art because teaching human cannot be reduced into rules and formulas. There is something that needs some empathy, some passion, and caring about people, because in our professions we are caring about human being. And it is very important to understand now medical education is built on competency-based medical education and built on frameworks. And there are several frameworks that exist, such as the CANMED, Canadian Medical Education Directives Framework, ACGME, Accreditation Council of Graduate Medical Educations, Tomorrow Doctors, and others. And we have also example of competency framework here in the UAE, in the country, is Emirates MITS, in which built on 9 thematic roles, such as being medical expert, social accountable, professional, and so on. On the left side is a competency framework for the medical graduates, and on the right side is the competency framework for dental graduates. Let's go back to learning and explore the principles of learning and what makes learning effective. The most important principles of learning is to organize. If we have structured informations and organize informations, this will help us to learn effectively. We need to be engaged with the material. This is very important. Through active practice, taking notes effectively, concept notes, studying effectively, and so on. We need to apply what we learn, because if we don't use it, you will lose it. It's very important. And we should have a good reasons for learning. We should consume the information that is relevant in our practice. Any single information that we study in the medicine, dentistry, and health science, it's very important for the future practice. And some informations may be considered as life-saving information in the practice. So we have to pay attention to that. I will go through the different principles that shown in these slides with addressing it from different angles. It is very important principle, and one of the core principles is retrieval practice. And learning improve actually when we try to recall information. So this is very important. And this is very important. Before looking at the notes, we have to actively engage with the information. And this could be exampled by test-taking, self-testing, practice question, and explaining the concept aloud. This is very important. The other principle is spaced repetitions, because if we don't repeat, we will forget this information. And learning strengths when material is revisited over the time and at interval. This is very important thing that we have to consider. And studies show that spaced repetitions improve long-term retentions and reduce last-minute cramming before the exams and support clinical recall, because medicine is always about practice. And we should avoid, we should make it in intervals and in a short sessions, repeat it oftenly, rather than not in a long sessions. And this example of spaced repetitions. For example, we can start immediately revise at the end of the session in 5 minutes, then maybe after short break, and then at the end of the day, 2 days later, after week, after months, we can plan for that. This is very important, the concept of spaced repetitions. And it is a learning technique, actually. Spaced repetitions involve reviewing and revisiting the material at increasing interval of the times, as you can see here in the screen. The third principle is the organizations and meaning. Learning improves when information is organized, connected to each other, and meaningful. And the third video will be about concept mapping. And in concept mapping, we'll learn how to organize, how to connect information, and how to keep it meaningful. So the strategies could be concept mapping, linking basic science into clinical cases, and some medical schools are using problem-based learning, which can help. In simulation-based education, also very important. And bear in mind that grouping ideas by mechanism, not the topics, is very important. And organization actually support understanding. This example of mind map, also one of the useful tools that we can use to help us to organize information. The most important also principle is application. So knowledge becomes useful when we apply it. And application include having clinical scenarios, case discussion with colleagues, and learning through problem-based learning effectively, and practicing like Muk-Oski. So bear in mind that if you cannot apply it, you don't know, and you don't yet know it. So it's very important. So when you apply, you can make sure that you know it or not. The fifth important principle is feedback. And if I'd like to recommend two important skills that you need to learn in your study, is mastering feedback and reflection. Feedback guides our learning. The most we are able to receive feedback effectively, the more successful we will be. The importance of feedback, that feedback helps us to identify gaps, to correct misconceptions, and to improve performance. You should seek early feedback, and you should not wait until the exams. And it's very important to bear in mind that learning strategies are very important, and poor learning strategies are very dangerous to you as students and in the future practice. So why poor learning strategies are dangerous? Because poor learning leads to superficial understanding. It leads to rapid forgetting and poor clinical reasonings, and this ultimately will lead to unsafe future practice. On the other hand, effective learning is a patient safety issue. Now we will move forward into the science behind learning. As we said, that medical education is the art and science. And it's very important for us as learners to understand the learning theories behind learning. Learning theories are frameworks that describe how individuals acquire, process, and retain knowledge. Understanding these theories is crucial, as it provides a foundation for optimizing your learning strategies. What is the theory? Theory is the rational type of abstract thinking about a phenomenon or the result of such thinking. And it is scientifically acceptable general principles or body of principles offered to explain phenomena. There are several examples of learning theories. I will describe to you some of them. One of them is behaviorism. I tried in this video to make it very simple, not going into detail about the theories. Basically, behaviorism based on the principle that learning informs through feedback, like um, having exam in OSCE and having feedback definitely after the exams. This is a behaviorism. Connectivism is focusing on the memory and information process, such as using the concept map, mnemonics, and so on, or mind map. And constructivism, basically, learners build knowledge through experience and reflections, and something related to zone of enhancement in work in the zone of proximal development and in the schema. And connectivism is learning happens through the network and digital connections and so on. And it's very important to understand how does our human memory work. When we receive the information as a stimuli, it works. It goes to the sensory memory with the short capacity, very short capacity. If we don't pay attention, we will forget this information. Then it will go to the working memory. And if we don't start to practice, to do rehearsal, also we will forget it. Then the information will be encoded into long-term memory, which is a permanent memory. And then we retrieve informations by self-assessment and so on. So in order to restore the information in the long-term memory, it's very important to practice, to do rehearsal, and to do spaced repetitions, as we explained early in this video. So what do we need from these learning theories? Because it is very, there are many details about these learning theories, and details are beyond the scope of this video and this session. You actually need the following about the learning theory. You don't need theory labels to label them, this behaviorism or this connectivism or constructivism or adult learning theories or whatever. No. You need the strategy that imply, that work. So practice feedback will build your skills from behaviorism. Organizing build understanding. Application build reasoning. And peer discussion deepen learning. So this is abstract what you learn from the theory. And you should focus on what improves your performance. Very important learning theory we should not forget is the adult learning theory. And it's called as Undergraduate. It is a framework that outline principles of education for the adult learner. It's developed by Malcolm Knoll and focus on unique characteristics of the adult. And adult andragogy, unlike pedagogy, which refer to teaching children, andragogy is specifically tailored to adult education. And here the comparison between pedagogy and andragogy. You can stop the video and try to see this slide. This comparison based on the learner, the experience, readiness, and orientation and motivation. Basically, andragogy is related to the adult learner. They are self-directed and dependent. They have rich experience. They learn what they need to learn. So this applies the relevance and learning built on their experience. And there are many factors that can enhance their learning. And it's not like a dichotomy. So it is a continuum between the andragogy and pedagogy. This is very important. So what are the principles? The principles include the adult learner. They have self-directed learning. They have experience, readiness to learn, and they need immediate application of the knowledge, and they have motivation. So this is a very important fact. The term adult learning in this context is used to denote psychological and intellectual maturity rather than chronological age of individual. It's not related to age. It is related to psychological and intellectual maturity. Why this is important for medical school? As adult learner, you are responsible for your learning, not the professor. You learn best when the content is relevant, so try always to seek about the relevance here. You need to see the purpose and the application, and medical school treat you as a professional in training, so it's very important to be professional and to know your professional identity. And you have to always to seek about what motivates you to learn, and it's not only about motivation, it's about motivation and discipline. Let us define motivation. So in motivation, we have two part or two type. intrinsic motivation and extrinsic motivation. Intrinsic motivation for learning, it stems from the personal interest. What motivates you to learn? Why I want to be a doctor. And on the other hand, extrinsic motivation, external factors such as reward, social recognition, grades, and so on. Is it important? Yes, both of them important, but we should focus more on intrinsic motivation. And also, we need to define or to distinguish between motivation, consistency, and discipline. So motivation initiates the learning process like spark. Consistency ensures regular engagement, and discipline provide framework for sustained effort. So we need motivation, yes. We need consistency, yes. And most important, we need discipline. And the relationship between motivation and discipline can be shown in this. So discipline will help you to move in a steady way toward progress. And in order to study effectively, considering all these facts, we need to distinguish between the active and passive learning. Active learning, and it's very important for us to be engaged with the material, and it is a student-centered approach. And as you can see here in this image, in active learning, you can retain the information and the skills. And these slides actually show you the difference between, or the comparison between the active learning and passive learning. In active learning, you should be engaged with the material. This is very important. You should have active role in study. There should be high level of engagement. And you should work in a group using debate, case study, problem-based learning. And the role of the teacher here actually is the facilitator, not a directive role. And studies show that there is a very strong and better retention for the information. So please focus on the left side of the screen, and you can stop the video to see the comparison between both. I'd like you to take a screenshot of this slide carefully, and please do this SWOT analysis for your study. This is very important. And try to do this exercise in interval. Do it now, at the middle of the semester, at the end of the semester, and at the end of the year. Because this will enable you to know what is your strengths. You can start with the video on the left side. There are what is your strengths and what is your weaknesses. Are the weaknesses and what are the strengths? Is some issues internal. And what are the opportunities and threats? And we provide you with a list of questions that you can use. So this is the first step. The second step will be you have to analyze your strengths and weaknesses, and you can develop your learning needs. And the third steps it will be you should analyze the opportunities and threats that are immediately action that you should possibly take to optimize your learning process. So we discuss in these sessions the learning principles and how we study effectively in medical and dental school and health sciences school, and to maximize this benefit. Thank you so much for watching this video attentively. And now we will move to the third video, which will be about the concept mapping in the medical education. Thank you so much.